sections, the clinical role of molecular diagnostics. So we want to look at what relevance molecular diagnostics is to our work as laboratory technicians or people who do diagnostics. So we'll be looking at prenatal tests for chromosomal abnormalities, then screening tests, then we'll come to diagnostics tests for cystic fibrosis, then therapeutic decision and monitoring. Now, introduction. Molecular diagnosis is referred to as the detection of genomic variants aiming to facilitate detection, diagnosis, subclassification, prognosis, and monitoring response to therapy. So there are various areas. We are looking out for variations in the genome. We are aiming at detecting a particular infection or organism. We are aiding in diagnosing the disease. Subclassification talks about knowing the sub species, etc. of organisms. Prognosis still with diagnosis, and then monitoring the response to therapy. So when we are doing a treatment, what is the response to it? Molecular diagnostics is the outcome of the fruitful interplay among laboratory medicine, knowledge of genomics, and technology in the field of molecular genetics, especially with significant discoveries in the field of molecular genomic technologies. So it's an interplay of all these things: medicine, genomics, technology. All these factors contribute to the identification and fine characterization of the genetic basis of inherited disease, which in turn is vital for the accurate provision of diagnosis. So this capability helps us understand genetically what is causing the disease. High throughput methods such as next generation sequencing or genome-wide association studies provide invaluable insights into the mechanisms of disease, and genomic biomarkers allow physicians to not only assess disease predisposition but also to design and implement accurate diagnostic methods to individualize therapeutic treatment modalities. So there's what we call markers, biomarkers. Now, biomarkers gives you an idea of someone being predisposed to a particular disease. Now, we are saying that it is not only that benefit which we get from molecular diagnostics, but the fact that we can even individualize treatment or drugs and also monitor the treatment is a good outcome of molecular diagnostics. Now, let's look at prenatal tests for chromosomal abnormalities. So prenatal, before giving birth. Genetic disorders are caused by changes in a person's genes or chromosomes. So it's either a gene or a chromosomal mutation. Aneuploidy is a condition in which there are missing or extra chromosomes. So when they have missing chromosomes or extra chromosomes, it's called aneuploidy. In a trisomy, there's an extra chromosome. So you are supposed to have two, but this time you have a third one. In a monosomy, a chromosome is missing. Inherited disorders are caused by changes in genes called mutations. Inherited disorders include sickle cell disease, cystic fibrosis, Tay-Sachs disease, and many others. In most cases, both parents must carry the same gene to have an affected child. You know of heterozygous, homozygous, dominant, recessive. So we are saying that for some of these diseases to occur, both parents should have the traits in their genes before it will be expressed. So we are looking at chromosomal abnormalities in prenatal tests. So these pictures show the ways of getting your sample
for the chorionic villus sampling and then the amniocentesis. So you can see that there are three pictures. The left two, the two on the left are the CVS sampling, and then the right one is the amniocentesis sampling. Now you realize that in all cases, the ultrasound device is being used to monitor the fetus so that you do not pierce or have a negative effect on the fetus. Now, for the chorionic villus sampling, let me get mine too. For the chorionic villus sampling, so you realize that the sample can either be taken trans-cervical. So you go through the cervix and then with your syringe with a tubing, you pick the chorionic fluid. So that one is trans-cervical or transvaginal. Now, in the second instance of CVS, the sample is being taken trans-abdominal. So, hypodermic syringe with a needle has been used to pierce through the abdomen. Still, you can see your ultrasound machine guiding or your probe guiding the procedure. Then the chorionic fluid is being taken. So that is in the second instance. So for the chorionic villus sampling, you can either do transcervical or transvaginal and then transabdominal. Now when it comes to amniocentesis, you can see the picture. That one is being the amniotic fluid which is surrounding the child. So it is taken directly from the abdomen. So it is transabdominal. So still being guided by your probe for the ultrasound, and then the amniotic fluid is taken. So these are methods of taking the fluids for your genetic or molecular diagnostic sampling. Okay. So types of prenatal tests for genetic disorders. So you can do a prenatal screening test or a prenatal diagnostic test. One is screening, one is diagnostic. Now, prenatal screening test. These tests can tell you chances that your fetus has an aneuploidy and a few other disorders. So you don't have an idea of what might be in there. You are scanning, you are screening to see if there is something. Then your prenatal diagnostic test. These tests can tell you whether your fetus actually has certain disorders. So in that instance, you are looking out for a particular situation. These tests are done on cells from the fetus or placenta obtained through amniocentesis or chorionic villus sampling. So in the prenatal diagnostic test, you are zooming into a particular disease and checking if it's there. For the screening, you are doing a general overview to see if there is something wrong in there. So in effect, prenatal screening test evaluates an individual's risk of developing a genetic condition, while prenatal diagnostic tests identify genetic conditions already affecting the fetus. So one is checking the possibility of something going wrong, and one is actually checking the condition of the fetus. So prenatal screening and then prenatal diagnostic test. So we look at the prenatal screening test. Now, prenatal screening tests look for indication that your baby is at risk of having a health condition. These health conditions include chromosomal conditions such as Down syndrome, Patau syndrome, the neural tube defects, spina bifida, and then anencephaly. Now, you can also have birth defects, that is congenital heart or kidney conditions. So these are prenatal screening test. Now, screening tests are done with an ultrasound and a blood test. The blood test checks the levels of the pregnancy hormones and proteins. These include the alpha fetoprotein, a protein produced by the fetus, then estriol, a dominant form of estrogen, that's a hormone formed from substances produced by the fetus, then the human chorionic gonadotropin, that is produced by the placenta, then inhibin A, which is also a hormone produced by the placenta. So these are the screening tests that the blood does alongside the ultrasound. The alpha fetoprotein, the estriol, human chorionic gonadotropin, and then inhibin A. These are the some blood sample tests that are done, either hormones or proteins being checked.
So continuation, although it is necessary to perform amniocentesis or chorionic villus sampling to definitely diagnose most genetic disorders, in some circumstances, fetal imaging with ultrasonography, echocardiography, or magnetic resonance imaging may be diagnostic of a particular structural fetal abnormality. So the qualification is structural. That is suggestive of an underlying genetic condition. The objective of prenatal genetic testing is to detect health problems that could affect the woman, fetus, or newborn, and provide a patient and her obstetrician, gynecologist, or other obstetric care provider with enough information to allow a fully informed decision about pregnancy management. Prenatal genetic testing cannot identify all abnormalities or problems in a fetus, and any testing should be focused on the individual patient's risk, reproductive goals, and preference. So what the person desires to know, that is what you zoom in to do. Prenatal genetic testing has many benefits, including reassuring patients when results are normal, identifying disorders for which prenatal treatment may provide benefit, optimizing neonatal outcomes by ensuring the appropriate location for delivery and the necessary personnel to care for affected infants, and allowing the opportunity for pregnancy termination. So sometimes, based on the genetic outcome, pregnancy may be terminated. A usual diagnostic test that is done with prenatal diagnosis is to test for cystic fibrosis. So what is that? Cystic fibrosis is caused by mutations in the gene that produces the cystic fibrosis transmembrane conductance regulator, that's CFTR protein. In people with cystic fibrosis, that's CF, mutations in the CFTR gene can disrupt the normal production or function of the CFTR protein found in the cells of the lungs and other parts of the body. So it's a genetic disorder caused by a gene that is passed from a parent to child. It takes two genes, one from the mother and one from the father, for a person to have CF. If a person has only one copy of a gene for CF, he or she is known as a carrier. Carriers often do not know that they have a gene for CF. They usually do not have symptoms or may have only mild symptoms. Cystic fibrosis is a genetic or inherited disease that causes sticky, thick mucus to build up in organs, including the lungs and the pancreas. In people who have CF, thick mucus clogs the airways and make it difficult to breathe. Management includes ways of clearing lungs and eating correctly. So in the CF, cystic fibrosis, it is about accumulation of mucus in the lungs and also in the pancreas, and some such persons have difficulty in breathing. Now we come to therapeutic decision and monitoring. Therapeutic decision and monitoring. Now, molecular diagnostics has been employed to take decisions on which drug needs to be given a particular patient, and also to monitor effectiveness or otherwise of the drugs that has been given. So this is termed as the therapeutic decision and therapeutic monitoring, deciding on the drugs and monitoring the effectiveness or otherwise of the drugs. So therapeutic decision making. Drug choice, such as in the treatment of CRAS, is an example of a molecular diagnostic test that improves therapeutic decision making. The KRAS or CRAS is a protein encoded by the CRAS gene that plays a critical role in cell division, cell differentiation, and the cell destruction of cells. CRAS mutations that produce an abnormal overreactive CRAS protein are found in pancreatic, colorectal, lung, and other cancers. Detecting a CRAS mutation is used to determine patient suitability for certain therapies in colorectal and lung cancer. So if a person has that gene or that mutation, then the concern is raised. CRAS mutation testing is typically performed for patients with metastatic colorectal cancer or metastatic lung cancer via direct DNA sequencing or using PCR and other amplification-based methods. Now, when someone has a cancer and it gets to the metastatic stage, it's more like the growth is getting out of hand. The metastasis is the stage where the growth is getting out of hand. Now, at this metastasis stage, the treatment has to be done with the CRAS protein's possible mutation in mind so that you don't aggravate the situation for people in the metastasis stage. Now, CRAS mutation testing is just one of a growing number of examples of molecular diagnostics that help inform a physician's decision making regarding appropriate treatment. So the other concerns that are raised, that's diagnostic or therapeutic decision making can help. Identifying which patients are unlikely to respond to a specific kind of therapy reduces the costs of ineffective treatment. That would be measured in currency or in money, in terms of side effects, and then the time that could be spent on other treatments. So when you do this therapeutic decision monitoring, it saves you money, side effects, and then time. Now, therapeutic monitoring. Finally, many molecular diagnostics improve monitoring and management of disease. Some of the most common molecular tests are tests for HIV viral load in patients affected with HIV. Now, the HIV viral load tests are amplification-based tests that measure the amount of HIV RNA to determine how many copies of the virus are present, which is measured in copies per millimeter of blood. So you'd want to monitor the number of RNA copies that are present. Keeping viral levels or loads as low as possible is key to staying healthy with HIV. Because researchers and physicians have made great strides in the care of HIV patients in the 3 decades since HIV was first detected, essentially transitioning it into a chronic disease in many developed countries. The HIV viral load test has become an essential tool as patients cycle through different antiretroviral therapies and develop resistance to certain therapies. So as people develop resistance, we need to identify and understand how they are reacting to the drug, and based on that, we can change from one treatment regimen to another. Periodic HIV viral load tests indicate whether or not the disease is progressing, either because an untreated person's immune system can no longer suppress replication of the virus, or because the therapy for a patient in treatment is no longer working. The HIV viral load test is not used for initial diagnosis. This is often done with antibody tests. That's the initial test of antibody tests. But typically also it is used upon initial diagnosis as a staging diagnostic to get a first report on the progression of disease prior to treatment. So before you begin treatment, a viral load test is useful so you understand the number of copies of the RNA in the body. Based on that, then your treatment begins. The treatment regimen, either with the drug to be used or the dosage, can then be determined. All right, so we come to a successful end of this course, and I wish you the best in your studies. Thank you.